How many times have you bought a pain tablet, a cold and flu sachet, an antacid, or a cough syrup, and taken it just because everyone takes this? We live on autopilot medicines. Same products, same habits, very little understanding of what they actually do, or when they can quietly cause harm. Let's change that in one video. Today, I'll walk you through 10 everyday pharmacy medicine categories you should understand before you take them again. Pain and fever, cold and flu, sore throat and cough, acidity and gas, diarrhea and ORS, constipation, allergy and itching, muscle and joint pain gels and sprays, basic eye and nose drops, and vitamins and baby medicines. I'm Ammar, a licensed pharmacist, and this is Medicine Wise. If you want clear, honest explanations about the medicines you and your family actually use, hit subscribe and let's get smarter together. Quick note before we start. I'll speak in general, not about specific brand names. Names, doses, and rules change from country to country. Always read your own leaflet and follow your own doctor or pharmacist. This video is for education only, not personal medical advice. Number 1. Pain and fever. Most shelves have two main players, paracetamol and a non-steroidal drug like ibuprofen. Paracetamol is usually the first choice for simple fever and mild to moderate pain. It feels safe, but there is always a maximum daily dose. Cross that limit and you can seriously hurt your liver. Ibuprofen-type drugs help more with inflammation, period pain, and joint pain, but they can irritate the stomach, affect the kidneys, and they are not for everyone. Simple rule: if you have kidney problems, a history of stomach ulcers, you're pregnant, or you're already on blood thinners, don't just add extra painkillers on top. Ask your doctor or pharmacist first. Number 2. Cold and flu combinations. Those colorful sachets and tablets are cocktails. They usually contain a pain and fever ingredient, a decongestant for blocked nose, sometimes an antihistamine, and sometimes a cough suppressant. Two big issues: many already contain paracetamol, and people then add extra paracetamol tablets on top. And decongestants can raise blood pressure and heart rate. So if you have high blood pressure, heart disease, thyroid problems, or you're pregnant, cold and flu combinations are not always innocent. Before you grab one, ask yourself, what else am I already taking that might be inside this packet again? Number 3. Sore throat and cough. Here you'll see lozenges, sprays, and syrups for dry and wet cough. Lozenges and sprays mostly give local relief. They can soothe and numb slightly, but they don't magically erase every infection. Dry cough syrups calm the cough reflex. Wet cough syrups help loosen mucus. See a doctor instead of self-treating if you have very high fever, chest pain, shortness of breath, blood in the sputum, or a cough that lasts more than 1 to 2 weeks. Number 4. Acidity, gas, and indigestion. On this shelf, you'll find antacids for quick relief, gas products for bloating, and in some places stronger acid reducers like H2 blockers and proton pump inhibitors. For an occasional heavy meal, a short-term antacid can be okay. But if you need strong acid-blocking tablets most days for weeks or months, your body might be telling you there is a deeper problem. Warning signs include unintentional weight loss, difficulty swallowing, vomiting blood, or black, tarry stools. That is not just acidity. That is a doctor now situation. Number 5. Diarrhea and ORS. For diarrhea, most people say, give me something to stop it. But the real hero is ORS, oral rehydration solution. The biggest danger, especially in children and older adults, is dehydration. ORS replaces water and salts in the correct balance. Strong anti-diarrhea tablets can sometimes make things worse if there is fever, blood in the stool, or a serious infection. Red flags include blood or mucus in the stool, high fever, severe stomach pain, or diarrhea in very young babies or frail elderly people. In those situations, you need a doctor first, not just an over-the-counter fix. Number 6. Constipation. You'll see fiber products, osmotic laxatives that draw water into the stool, and stimulant laxatives that push the bowel to move. Long-term bowel health still depends on enough water, enough fiber, and some movement. Stimulant laxatives are usually for short-term rescue, not for everyday use without medical advice. If constipation appears suddenly, especially with weight loss, bleeding, or severe pain, that needs a proper medical check, not endless self-medication. Number 7, allergy and itching. Allergy tablets are some of the most common repeat purchases. You'll see non-drowsy antihistamines, better for daytime, and more sedating antihistamines, which can make you sleepy. Be careful combining sedating tablets with alcohol, driving, or operating machines. If a simple allergy also has swelling of the lips or tongue, difficulty breathing, chest tightness, or feeling of collapse, that is not a pharmacy problem. That is an emergency. On the cream shelf, some products are just soothing or anti-itch, but some contain steroids. Steroid creams should not be used everywhere and every day, especially not on the face or in babies, without proper medical guidance. Number 8, muscle and joint pain gels and sprays. Sprays, gels, and patches feel safe because they're not swallowed, but they are still medicines. Many contain drugs similar to oral painkillers, just in topical form. Avoid applying them on broken skin, near the eyes, or on very large areas of the body again and again. Wash your hands after use. If pain keeps coming back in the same joint, don't just keep adding layers of gel. Find out why that joint is complaining. Number 9, eye and nose products. You'll see lubricating eye drops for dryness, anti-redness eye drops, nasal saline sprays, and in some places, mild medicated drops. Anything that promises to get the red out of your eyes is not for constant daily use. If you have eye pain, vision changes, injury, or a contact lens-related problem, don't play with over-the-counter eye drops. That is a job for an eye doctor. For the nose, plain saline is usually very safe and very underrated. Be careful with medicated decongestant sprays used for too many days in a row. They can actually make congestion worse if you become dependent on them. Number 10, vitamins and baby medicines. This shelf looks innocent, and that's why it can be tricky. Vitamins and supplements can be essential in real deficiencies, pregnancy, or special diets. But sometimes they're just expensive, colorful urine if the body doesn't need them. Fat-soluble vitamins like A, D, E, and K can build up in the body if you take too much for too long. Never assume, it's just a vitamin, I can't overdo it. You can. Baby medicines need even more respect. Baby paracetamol, saline nose drops, and barrier creams are useful, but baby doses are based on weight, not guessing. Never copy an adult dose and just make it small. In newborns and very young infants, when in doubt, always see a doctor first. You don't need to memorize a pharmacology textbook to be safe, but if you understand these 10 everyday medicine categories, pain and fever, cold and flu, sore throat and cough, acidity and gas, diarrhea, constipation, allergy and itching, muscle and joint gels, eye and nose drops, and vitamins and baby medicines, you are already far ahead of most people standing in the pharmacy line. Medicines are powerful. Used wisely, they save lives. Used carelessly, they can quietly damage organs over years without you noticing. If you found this helpful, subscribe to Medicine Wise by Ammar for more clear videos on everyday medicines, vitamins, and health decisions. This is general education only. Always consult your own doctor or dietitian before changing your diet or medicines.